What? Oh, this just in. He's getting surgery. That's what they're saying. Hey guys, football season's back. Really excited. Unfortunately, we got some injuries to talk about, and Big Ben got clocked. Well, actually, he didn't actually get clocked. All he did was throw the ball. Let's take a look. All he's doing is throwing the ball. Nobody hit him. What the heck? Well, when we take a look at what's going on, so he's basically just throwing the ball, right? And he just went like that. Now you imagine the amount of forces that go through this joint. It's the average person, even for a hip, when you're walking or even non-weight bearing, you're putting 3 times the ground reaction forces through your hip. So within your joint, you could be putting several times the number of forces through your joint just throwing a ball, whether it's your shoulder, wrist, elbow. The elbow, we know, takes the brunt of it, okay? Now, some of that's related to throwing mechanics. Could there have been an injury? Could there have been some tendinopathy? Could there have been something going on that we don't know about? And in fact, we don't know anything right now. Is that right? We know nothing about his injury. Okay, well, let's imagine what could happen. Throws the ball, all right? So here's the elbow going, throwing the ball. All right, so you have several times the ground reaction forces. You guys remember physics? No? What? So, ground reaction forces, force vectors going through that joint. Now, what could be happening? Can you imagine the amount of forces? This elbow goes back and forward. Now, you could also have the mechanics of the shoulder. Now, what else could happen? You got nerves, bones, cartilage, muscle, tendon, blood vessels. What else is there? Lots of stuff. But common being common, let's look at what are some of the common injuries. Now, could he have some tendinitis? Now, we know that all the tendons and muscles that supply the dorsum of the forearm, and that's called a lateral epicondylitis, a lot of them start here. You also have the brachioradialis muscle coming here. You have the nerves coming all around here, posterior interosseous nerve, radial nerve, musculocutaneous nerve. You got the ulnar nerve on this side, you got medial side, but he seemed to grab right there on the outside. So that makes me think, could it be some sort of subacute tendinopathy that then caused some severe injury, partial tearing, could even add a rupture. Now, an entire rupture of your extensor wad is pretty rare and uncommon, but I've seen it. I've seen it happen. More than 50% of the extensor origin tears off. Could that happen in him? I hope not. He's an athlete. I mean, these guys are at the prime, so you would hope that doesn't happen, but maybe he had some tendinopathy. Could he have had a steroid injection? Could he have had some treatment before? We don't know everything that's going on. We only know what's publicly released, and right now, nothing is released. So, what else could be happening? This kind of force puts a lot of shear mechanics on the cartilage. So could he have sheared part of the capitellum, radial head? So could it be a cartilage injury? Could it be a fragility fracture, minor fracture? Could it be many of those? But common things being common, could it be the lateral ulnar collateral ligament? Could it have ruptured? Could it be the extensor wad? Could it be the tendons? Could be a lot of things. Could it be an underlying arterial malformation that was previously subacute, unrecognized? Yeah, sure, very rare, very uncommon. Could it have been a capsular tear? Could it have been a cartilage rupture? Could it have been nerve, muscle, bone, tendon? Lots of things, and we don't really know, but what we do know is that he's a prime athlete throwing very high forces, the football through this elbow joint. So, what? Oh. This just in. He's getting surgery. That's what they're saying. What could that mean? Well, if he's getting surgery for this, and it's an elbow injury, and they're not saying anything about his neck or nerve, and they're talking about his elbow, then I would suspect it's likely either a ligament or tendon rupture. So I'm not saying that he is having tendon or ligament reconstruction repair or anything because I'm not treating him. However, that could likely be the case, especially for the mechanics. You suddenly throw it and then pop, something goes off, or it just tears, or he had something subacute that then tore. Could it be a collateral ligament? Could it be a ligament? Could it be a shear cartilage, possibly the capitellum that shears off or part of it, and he has to undergo an arthroscopy? We'll have to address that when we find out what actually happened. But for now, that's what I know.